Hello dear viewers, and we're back again after that report. Now, in the past, sleep-related breathing disorder were often considered minor or simply a nighttime nauseous. However, modern medicine has revealed that many of these conditions represent a serious disease known as obstructive sleep apnea. In this condition, breathing repeatedly stops or becomes significantly reduced during sleep due to upper airway obstruction. Now, this disorder does not only affect sleep quality, its impact extends to the cardiovascular system, brain function, metabolism, and overall quality of life. Now, today it is recognized as one of the most important chronic sleep disorders strongly associated with modern disease such as obesity, hypertension, and type 2 diabetes. Now, within the field of otolaryngology, head and neck surgery, a new subspecialty has emerged over the past 3 decades known as sleep surgery. So let's welcome Dr. Abdulmohsen Alterki, Chairman of Head and Neck Surgery Faculty, Kuwait Board of Postgraduate Training Program, Kuwait Institute for Medical Specialization, KIMS, Ministry of Health, Kuwait, and welcome to the show.
Welcome. Thank you. Thank you
I
for the invitation.
couldn't pronounce that actually.
Yeah, it's otolaryngology. I mean, it's usually it's called ENT, but otolaryngology, auto means for the ear, laryngology for the larynx, and then head and neck surgery. So
okay,
it's basically covering a lot of, let's say, anatomy.
I know ENT, but
ENT is the one that people talk about because it's easier and more attractive, but the name changed. Because actually ENT, almost 70% is all about head and neck, not just the nose and the throat.
I like how you said it's attractive.
It is.
All right. Now, with that said, what is exactly obstructive sleep apnea?
Well, obstructive sleep apnea, basically people when they talk about snoring is basically the air goes through your upper airway, which starts from the nose. It's narrow, so you get these vibrations and you get this loud noise.
Yeah.
But that's not a disease, it's a complaint. Now, the problem with obstructive sleep apnea, what happens is that you get this complete cessation, like, you know, the airway completely shuts down, and then you get these apneic episodes. So basically, snoring, air goes through, but narrow. Apnea, there's no air going through, and that could happen for 10 seconds or more, and that could happen if you have severe sleep apnea, hundreds of times per night, every night, 7 days a week.
Wow, that's a lot. So many people snore.
Right.
How do they actually know when snoring becomes a medical problem?
Right. Well, I mean, when you snore, you know, a lot of people snore. And then when it's something like, you know, your jet lag, you may be a little bit like, you know, overeating at night. These things happen. But let's say if you snore, let's say 5 days a week, and the wife, the husband, the mother, the father kind of finds out that not only you snore, you get these obstructions, you get the headache, you get the fogginess, the continuous lack of energy, then this is a medical problem. And actually you're lucky because you have some symptoms that you can go to a doctor and say, I have this and that, and then the doctor can go and basically, you know, do the testing required to confirm if you have sleep apnea or not.
All right. What are the basic mechanism of snoring? Why does it happen actually?
Well, you know, the snoring basically it's more of a mechanical problem because what happens is that you got this lumen that starts from the nose all the way to the windpipe, and what happens, you get a lot of soft tissue. So because of obesity, because of the muscles are not highly toned, they kind of become more laxed. So when the air goes through, it vibrates, and that's what happens basically. But it's not, as I said, it could be a complaint more than a disease by itself.
All right. Now, with that said, how common is sleep apnea?
Oh, it's fairly common with the technology now. We know that, and what obesity and other, you know, lack of exercise, the quality of food, especially in Kuwait, as you know, these things kind of makes it more common, and it's in adults and in kids. We believe that at least maybe 5–6% of people that they know they have sleep apnea, but the problem is 80% of people have it, but they don't know they have it.
All right. So where's the problem in it exactly? Like, especially if kids started developing it.
Right. Well, I mean, with kids, we know that, you know, it's a triangle of 3 things. You know, to have a healthy child, you need good food, you know, healthy food, exercise, and good quality sleep. Now, sleep is important because what happens is that it's not a luxury. Sleep is part of your build-up. You know, you sleep third of your life, you're sleeping, and you're sleeping because there's so many things happen when you sleep regarding, you know, there's a hormone called growth hormone, the muscles relax, the oxygenation of the blood, of the heart, the kidneys, the lungs, all these things need harmony, don't need interruption. So when you have apnea and the oxygen drops every 5 seconds, so you really slept, but you didn't get a good quality sleep. Now when this happens, obesity, poor academic performance, headaches, lack of concentration, and we're lucky enough because we started the last few decades talking about it, and so we pick up kids early, so they don't go into adulthood carrying their, you know, excess luggage to them, and then suddenly you get, you know, cardiovascular issues, you got diabetes, you got brain fogginess, concentration, and lack of it. So the issue is that now we're getting better at it, like we're diagnosing it early, so we can pick up the patient or the one who's having the problem earlier than waiting to develop other irreversible diseases, and then, you know, I'm sorry, you got the problem, then you have to fix it.
So with me, I do snore sometimes at night,
Right.
and I realize it every time I go like a kilo or two above a specific weight limit. I start snoring.
Absolutely.
When I go back down, it's fine. And what I also realize that when I do snore, the next day I wake up in the morning, I do feel like pain here or under my throat.
And that's what came to your first question, the vibrations.
The vibrations.
Because there going to be lots of resistance because of the deposition of like the turbinates and the palate. So what happens is that when you gain weight, you get more fat. And it's not all the belly itself. It's also in your neck, around the face. So the more fat deposition, and the muscle tone gets, because when you get like, when you eat heavily caffeine, and there's a lot of things that kind of drop down your resistance in the airway, so it becomes more lax, and then hence the vibrations, and that's only an explanation. But because of these vibrations, what happens, what's the impact on your heart, what's the impact on your brain?
I do sometimes get headaches because of those vibrations.
Because you didn't get the high quality sleep that you need to.
All right. Now with that said, how has treatment changed over the years?
Right. Well, I mean, as I said, you know, in the beginning, introduction, you said something called sleep surgery. Sleep surgery is a subspecialty arised from ENT. Let's make it simple. And there are 7 divisions in ENT. Like, I mean, there is the board you do it, and then there is 7 divisions. One of them now is the sleep surgery. Basically is part of the surgery that you identify there's a problem, like say, you know, deviated septum, tongue, palate, tonsil, and you kind of fix it and make sure that it's something that you make it tighter and you open the airway. And now with the new technology, there's a new chip that you put in the underneath the tongue to move the tongue forward, and that's, you know, something that's been happening in Europe and in the United States, and started in Kuwait actually. And Kuwait is one of the first countries in the region that start doing it. And the great thing about it is that we have the tools, we have the instruments. Now our problem is the selection of patient, who's fit to do it, who's not.
So when you say the chip is there, it's mostly for people that sleep, let's say, on their back?
No,
and also it's like an electromagnetic that actually
it's basically there's a nerve that goes to the tongue, and basically you stimulate that nerve to come forward, because when you lie on your back technically and you have this problem with apnea, your tongue goes backward. So once it goes backward, the chip kind of works and bring it forward. So it opens. So
it doesn't actually has a problem. You know, occur a problem of suffocation.
The apnea episode, which is the collapse. And also this is also very selective. It's not like everybody come in, let's put a chip in.
Of course.
But you do something called drug-induced endoscopy. We put patient to sleep, and then we look where is the collapse, and that we started in Kuwait back in 2014. That thing basically tells us who's fit for what. So now in sleep surgery, it's custom made. It's like you do the testing, you do the required investigations, and then you decide. Like say, if you have 2 brothers with the same problem, you're going to have 2 different solutions.
True, yeah.
You know what I'm saying? So it's not. So it's mainly custom made, or what we call personalized medicine. It's not like, you know, one glove for everybody.
Yeah,
you know.
not every apnea is apnea.
Absolutely.
Not every headache is a headache.
Absolutely, absolutely.
Very true. So what is the biggest challenge in sleep apnea today?
The biggest challenge is that if you're lucky enough and your spouse or your father, your loved one finds out that you snore, you got these episodes of apnea, then it's a bad thing. Snoring is, it's embarrassing, but at least you have a complaint. So you go to your doctor, and then the doctor starts doing, the workup and decide surgery, lose weight, put what they call a CPAP, which is still gold standard for sleep apnea. My problem is that the ones that don't complain, the ones who present with the complications rather than the symptoms, like suddenly you're diabetic, suddenly you get a heart attack, suddenly your fogginess in the brain is not doing well. And that is my challenge. The next step is to go to the regular person and tell him, sir, there is a problem. Yes, it's not been detected yet, but with the technology now, we can find out and prevent something that could happen, God forbid, in 5 years' time or 10 years' time. That's the new challenge.
I'm smiling because my wife always tells me you snore at night a lot.
Right. So I think maybe we should see you in the clinic soon.
I actually went to the sleep test,
right,
and they told me you go to deep sleep in 2 minutes, like so quick, and it's fine. It's just that either you should watch over your sleep or just go check your as they say, nasals, yes, and see if there's something there.
So it's just what we call fine-tuning, basically, but you don't have sleep apnea, which is something very good. But the problem is 80% of people that have apnea, they don't know they have it.
Yeah.
And that's the challenge, is that how to find out, I'm talking adults and kids, men and women. So the challenge is to find out about it, and that's what brought up the patent that we did with Desman Diabetes Institute, with collaboration with Sabah Al-Ahmed Center for Giftedness Creativity, and both go under the umbrella of Kuwait Foundation for Advancement in Science. And this has been going on since 2010.
Wow.
It developed in 2000, we kind of started picking up data in 2016, and now we're lucky enough to get a patent. Now, the patent is all about, it's all, of course, not commercialized yet, but we're aiming to go, hopefully, the next level. Now, the great thing about it is that you don't need to go to a sleep lab. You went through it.
Yeah,
go and do the testing. No, you can do a simple blood test, and that will kind of clarify who needs what and are you high risk or not.
Oh, so now it's a simple blood test.
Basically.
Wow.
So imagine you went through the sleep test. If I tell you do the sleep test or do the blood test, which one would you do?
I will do the blood test.
Right, and at least the great thing about it's not like it's going to be, tell you exactly what you're having, but at least, let's say, someone who think he doesn't have, and then you tell him there's a blood test that you do, and then, no sir, the number is high,
so
you need to go and...
So where people should actually go to do this test?
Well, the thing is now, Desman Diabetes Institute, because, and the reason we're doing with Desman Diabetes, because if you have obstructive sleep apnea, they severe. The risk of developing diabetes is almost 60%.
Oh.
So back in 2000, and that's my aim of going, when I joined my colleagues there, the scientists, is that back in 2008, there was an institution called International Diabetic Federation, which is basically, let's say, it's the United Nations of Diabetes. What they did actually, they said, if you have type 2 diabetes, look for sleep apnea. If you have sleep apnea, look for type 2 diabetes. And that's why a surgeon is working with diabetologists to kind of find out how to work around it.
All right, perfect. Now with that said, what does the future look like and what is your final message? Okay,
well, the future, if things are going, because the Kuwait Foundation for Advancement in Science, the Ministry of Health are very supportive, and they think there is potential out of it, something coming out of Kuwait to make a difference for the whole neighboring region, the whole world. Now, if we get that commercialized, that will change what we call sleep medicine.
All right.
And my message is that if someone is having a snoring problem with headaches, with fogginess in thoughts, short-term memory loss, this is not because you're snoring. This is because you have obstructive sleep apnea, and this can be diagnosed and this can be treated appropriately to prevent something that might affect, God forbid, in the long term on your brain or your heart.
All right. Thank you so much, Dr. Abdulmohsen, and we hope to see you soon again. And thank you for the wonderful message and the informative information about everything that has to do with sleep apnea.
Pleasure. So thank you very much.
You're welcome. So thanking our guest, Dr. Abdulmohsen Alterki. And now we're going to go for a short break, and we'll be back for more right here at Good Morning Kuwait.